We are live. We are live. We are live. I am Dr. Frita, and welcome to another episode of Medical Monday, where we talk about all of the hot health topics in the headlines. Today, as always, we've got quite a few health headlines to cover. So let's start off with my favorite game, myth versus fact, and we'll be talking about whooping cough. Have you heard of whooping cough? Have you seen whooping cough? Probably not too much, since we have vaccines that keep it pretty low. But now, guess what? As the vaccinations have decreased, less people want vaccines, whooping cough results are going up. We have more than doubled the number of whooping cough cases this year. We've more than doubled it since last year. And yes, whooping cough can cause death, especially in young children. So you don't want to miss this. And then we'll talk about Beyonce and Solange's mother, Tina Knowles, because she has shared that she was diagnosed with breast cancer. She was also very open and honest to share that she had actually missed some mammogram appointments. So we'll talk about breast cancer, the importance of making those mammograms, regardless of how busy you are. And we'll also talk about who's at highest risk for breast cancer and why Black women are more likely to die from breast cancer than any other ethnic group. And then we'll talk about dye. Now, earlier we talked about certain red dyes being banned, but now the FDA is moving to ban 6 more petroleum-based dyes and to switch them to more natural dyes. Does that sound good to you? Sounds good to me. But we'll talk about some of the potential side effects of the current dyes we use and why has it taken us so long to get rid of this, even though the science has supported it for quite some time. We'll get into it. And then y'all know I love talking about Lizzo in the headlines again. Well, she's reached her weight loss goal. And so she's sharing some of the secrets and the diet swaps for how she got to her weight loss goal. We'll talk about her. And then we'll also talk about Jason Biggs and how he had a huge improvement in his cholesterol numbers from losing weight. So we'll talk about some weight loss strategies and why it is so important to be at a healthy weight. It's not just about vanity. It's about your health. Lastly, we'll get into that 5-minute health check where I'll quickly go over things like, foods that have been recalled or different diseases that are on the rise. Just a quick 5-minute health check. And of course, we always have a little time for some Q&A and some live interaction. But today we actually have our members only Q&A immediately following this live. If you're not a member, it's not too late. Just come on over to YouTube, join us, and we'll have our members only Q&A. All right, y'all, let's go ahead and get started. We have a great show today. I'm Dr. Frita, and this is Medical Monday. All right, welcome. We are live. I'm Dr. Frita. Let's get into this Medical Monday, and thank you for joining us and making Monday your healthiest day of the week. I don't do this alone. Shador, my practice manager and my co-host, please come to the front of the stage. How are you doing, Shador?
Hey, good, Dr. Frita. How are you?
Did you have a good weekend? I'm doing great.
Yeah, I think my recent, we had T-ball.
Oh, shoot. How did he do? How did he act?
Same as usual. He does okay on defense. Outfield, nobody's paying attention to him. Come play offense, and he's batter up. Is all eyes covered. Don't want to hold it back. Don't want to run to the bases. So we're working on it.
Working on it. Does he bat left?
Yes.
He's a true lefty, just like his mama. That's pretty cool. Cool. Well, Shador, I thought about you all weekend long because I kept hearing your name.
Really?
Shador Sanders, that is.
Every time he's able to get drafted.
Draft.
Yes.
Shador. Yeah. So I'm so excited that he finally got drafted. And y'all gonna have to make this make sense to me because he's a highly skilled quarterback. And I know there's been different mumblings and people saying that's political because of his dad, Primetime, because he doesn't, bow his head and shuffle in, and he's not, doesn't display a whole lot of humility. Either way, talent is talent. And I'm very happy that he did end up getting drafted by the Cleveland Browns. And I'm not going to lie, just to be petty and out of spite, if nothing else, I hope that he takes it all the way to the Super Bowl and in your face. I don't appreciate people playing with people who actually have talent to make some type of a political point. Not that I know that's what was done for sure, but that's just how it looks to me from outside looking in. But anyway, we had a great weekend. This is my first out-of-state travel for AAU basketball with my daughter. We went to Ohio. and they had great games. They won all of the games that they played.
Oh, yeah.
So the next big stop would be the Run for Roses this
Mhm.
summer in Kentucky. And so my daughter had a really good time. She got to bond with her teammates, and it was a good time. I didn't have any fights with any moms or arguments. I started to give this one mama a dirty look who kept keeping my child's number in her mouth, saying, number 14, wash them elbows. Number 14, travel. I wanted to tell her, keep my daughter's number at your mouth, but I turned around. Shador, you know I'm 5'11".
Mhm.
This lady was taller than me.
Oh my gosh.
She was bigger than me, and she was not soft. She was thick like a milkshake. So I turned, I was gonna give her a dirty look. I sized her up. I'm like, oh, I can't take her. I turned right back around like this. No, but anyway, it was a good weekend. It was a good weekend. So now let's go ahead and start off and have a good week, Shador, shall we? Let's get into these topics for Medical Monday. But first, who was the first one in the chat?
First in the chat today is Miss Andrea.
Hi, Miss Andrea. Thank you for
Good
coming.
afternoon from Pennsylvania. Happy Monday.
Hey, from Pennsylvania. Thank you. Welcome, welcome. Real good. All right, and let's see. So we should be streaming. So of course we're streaming here on YouTube. And again, I want to say thank you to everyone who supports us here on YouTube. Here on the Dr. Frita YouTube channel, we have over 850,000 subscribers. I appreciate you. If you haven't subscribed, please subscribe. Join us. We have lots of evidence-based medicine, lots of great videos broken down in a way that's easy to understand. I also want to thank my Facebook followers, my Instagram followers, everyone who joins me. Hey, I see y'all over there on TikTok, LinkedIn, but right here streaming. Let us know where you're streaming from, where you're watching us from, and we'll go ahead and get started. Now, if you are new to this channel, it is very interactive, and I like to play little medical mind games. Let's start off playing a game about the whooping cough, because as I mentioned, whooping cough has more than doubled since last year. So let's start off playing this clip, Shador, and then we'll get into our myth versus fact questions where I expect you to answer and we interact.
All right.
We're going to turn now to a GMA health alert on the rise in whooping cough cases. The CDC reporting cases are more than double what they were this time last year. And our chief medical correspondent, Dr. Tara Narula, is here with more. Nice to see you, Doc.
You too.
What is happening and why is it happening?
So yes, whooping cough is a contagious respiratory illness caused by a bacteria. And in fact, we are seeing now a little over 8,000 cases, which is more than double what we saw last year the same time. Last year, we saw about 35,000 cases total, which was the most we had seen in the last decade. So cases are definitely on the rise. We usually see about 10,000 per year pre-pandemic. Why is this happening? We talked about this with the measles, but probably lower vaccination rates. So in 2023 to 2024, about 92% of kindergartners got their vaccination. That's compared to about 95% pre-pandemic. So whooping cough starts out as really what looks like a cold, but then it develops into something that's more associated with rapid, kind of violent episodes of coughing, so violent that you may throw up, you may develop a headache, and then when you take a breath in, you hear that high-pitched whooping sound. It's spread by respiratory droplets, so when someone sneezes or coughs, we diagnose it with a nasal or throat swab, and then we like to treat it early in the first 3 weeks with antibiotics. Now, it's important to know that for babies, they may not have those classic signs. What you might see is that they're struggling to breathe, their lips, skin, or nails are turning blue, those kinds of things, or actually they are pausing when they're breathing. It's sort of stopping briefly.
Which is terrifying.
Yeah.
Very good. All right. So yes, the whooping cough is very real. And again, it can cause babies to pass away. And Shador, this one actually hits home for me because when I did my pediatrics, my internal medicine pediatrics residency at Georgetown, I actually had a young child to pass away from whooping cough. He was in the PICU, the pediatric ICU. And because, we've had the vaccine for whooping cough since the 1940s, it's just not anything I had run into. It wasn't common. This young baby actually happened to be from out of the country. He was not vaccinated and he passed away. And I remember thinking in residency, oh my gosh, I'm so glad that I'm in a country, the United States, where it is required that children get vaccinated from whooping cough. So at least we don't have to watch children pass away. Well, now with those rates of vaccines going down, we're seeing whooping cough again here. We're seeing young kids pass away, just like with the measles. And I want y'all to put in the comments, everyone here in the chat and on replay, tell me, what do you think is going on? Why are less and less people getting vaccinated against diseases that we know kill babies? What's happening and what can we do to make things better? Meanwhile, let's go ahead and get our first myth versus fact statement up, Shador.
All right. Whooping cough is only dangerous for children.
Whooping cough is only dangerous for children. Put an M1 if that's a myth. Put an F1 if that's a fact. Whooping cough is only dangerous for children. All right, myth versus fact statement number 2, please, Shador.
Whooping cough cases are rising due to a new strain of bacteria.
Okay. Whooping cough cases are rising due to a new strain of bacteria. Put an M2 if that's a myth. Put an F2 if that's a fact. All right, pencils down, pencils down. Let's get into these answers, and then we'll talk more about whooping cough, what causes whooping cough, what we can do to prevent whooping cough. And I do want to get your input on why you think these vaccine rates are going down for vaccines that have been safe for decades and decades and have saved lives. What do you think is going on? All right, Shador, do we have any takers for the first myth versus fact question?
Absolutely. We'll revisit. Whooping cough is only dangerous for children. So
All right.
majority are going with myth on this one, Dr. Frita.
Who? Give me some names.
Miss Katrina.
Hi, Miss Katrina.
Lisa.
Hello, Lisa.
Mr.
Mr. Hey.
Our member is Caitlin. Please.
Hi, Miss Caitlin. Thank you for being a member. Oh, I hope you can join us today. Right after this live, we're having our members only Q&A. Oh, and yes, for those of you who are new to the channel, I am Dr. Frita. I am an MD. I'm a medical doctor. I am board certified in nephrology, meaning I'm a board certified kidney doctor and a board certified high blood pressure doctor. I have also been board certified in internal medicine, pediatrics, and most recently, I became board certified in obesity medicine. So for the members only live Q&A that we're having today and that we have every month, you get a chance to ask me whatever questions you have, and I will answer your questions. Just, you know, you can go back and forth, ask me many questions. You can even come and join us on stage. So if you want to run something by me, something that your doctor has said, or just something you're curious about, what I provide is information, but I have a lot of information to provide. So please come on and take advantage of this. If you're not a member, hey, click the link in the description. It's not too late to join. All right. Thank you for joining us this morning. All right. So all of these folks, Shador, have said that it's a myth, that it's not only something that affects babies seriously.
Mm-hmm.
All right. Does anyone say it's a fact?
No, not for this statement.
Ah, okay. All right. So you are all correct. It is a myth. So while, yes, babies, especially babies, less than 1 year of age, are at highest risk for getting very sick from whooping cough, people who are adults, people who are immunocompromised with other chronic lung issues like asthma, they can also be seriously affected by whooping cough as well. So it's not just the kids, even though less than 1, that's who we think of mostly as being affected. Other people can be affected as well. All right, let me see if I tripped y'all up on this myth versus fact statement number 2. What we got?
All right, whooping cough cases are rising due to a new strain of bacteria. Do you have a mixed bag on this one, Dr. Frita?
Good.
Bag.
I like to mix it up. Who'd I get?
All right. Mr. Randy, hello, says a fact.
Hi, Mr. Randy. Okay, hold on. So he says a fact that the cases of whooping cough are on the rise due to a mutation. Okay. Mm-hmm. The whooping cough has gotten smarter. It's gotten trickier. It's a mutation. We haven't caught up with it. Okay. So he says it's a fact. Okay.
Lando agrees. It's a fact as well.
Okay. New strains. All right.
Also, Miss Katrina, she says a myth.
Oh, Miss Katrina. Okay, she says it's a myth. So you don't think it's because the bacteria has gotten really, really smart and tripped up. You don't think that's why the cases are going up? All right, let me remember your name here, Miss Katrina.
Miss Thelma also says it's a myth.
Miss Thelma says it's a myth. Okay.
Where are we going with, Dr. Frita?
All right. Miss Katrina, Miss Thelma, you are correct. I did not trip y'all up. It's a myth. Now, It's interesting because I know where everyone else is coming from. When we think about, certainly most recently with what caused the lockdown of 2020, C-19, every time the cases would go and get worse, and it would get more virulent and more people would pass away from C-19, during the pandemic, it was because of all of these tricky mutations, right? The virus kept changing. But when it comes to whooping cough, the increase in cases is actually not because of a genetic change. The whooping cough is a pretty simple bacterium. It hasn't changed much. The cases are going up because people are no longer getting vaccinated. Isn't that something? So it's not the bacterium that's changed, it's us not getting vaccinated. That's why the cases are up, not because of a genetic mutation. Yeah. Which then takes me to my question. Did anyone comment on any of the chats? Why? What do you think the problem is? Why are less people getting vaccinated?
Yes, it did. So from IG, Miss Shelley.
Hey, welcome from IG. Hey, everybody from IG. Listen, we're almost up to 50,000 subscribers in IG followers. So if you're not following me, please follow so we can have a little celebration. We're almost up to 50,000 on IG. On Facebook, hey, Facebook, we broke the 50,000. We're over at 50,000. And of course, thank you to everyone here on YouTube, where we're over 850,000 subscribers, marching steadily to 1 million. All right, so what comments do we have from IG?
So Shelley says they're worried about side effects.
Oh, okay. Worried about side effects. All right, that's a good point. So the only thing is, the whooping cough vaccine has been out since the 1940s. So with the C-19, that COVID vaccine, I did understand because that was a brand new vaccine while people were worried. But for something that's been out since the 1940s, with all of the long-term data, we would really know. Yeah, but that probably is a concern. So that's something that's valid to think about. So maybe as clinicians, we should stress all the research and all the studies and the low chances of side effects in most people. Okay, that's good.
Miss Katrina.
Hi, Miss Katrina.
She says vaccines are likely decreasing due to misinformation. It is at an all-time high. Very sad.
Now, see, and you hit it. There's a huge misinformation. And it looks like after everything that happened with the 2020 lockdown, that misinformation increased. And we talk about it with the measles, right? Where we had our first death in a decade. We hadn't had a death since 2015, and now we've had 3 deaths from the measles just this year. And even our head of the Department of Health and Human Services, RFK Jr., has been the main one spreading misinformation. I was shocked that just a few weeks ago, he actually finally stated what science has known for years, that the best way to prevent measles is with the MMR vaccine. And again, if you get 2 doses of the MMR vaccine, you have a 97% protection against measles. But same thing with the whooping cough. If you get vaccinated, you have a very high protection. Okay. So I'll go ahead and talk a little bit more, Shador, and then you could tell me if anyone else has commented on what we can do about these vaccine rates. So what in the world is the whooping cough? We talked about it. It was covered in the clip some. It starts off where you just have symptoms of a common cold. But instead of the symptoms just lasting for like maybe a week, 10 days, like a common cold symptoms will last, the whooping cough gets very severe, and it can last for weeks to months. And what happens is, especially with children, they start coughing, and then it becomes a whooping noise, like a whooping noise, and they can even stop breathing. And my father tells a story. My father, Dr. Freddie McCrae, he's a retired general and peripheral vascular surgeon. Listen, Daddy, if you're on here, please put a comment. I know you're not going to, but he used to tell me a story of when his siblings would get whooping cough. My grandma, Jetty Lee, when they stopped breathing, because that's the issue. You can stop breathing, have apnea, turn blue, and it can even be fatal in children. That's the issue. He said she would literally kind of toss the kids up, and then, when they hit her chest, then they could start breathing again. Mm-hmm. So that was almost like a creative way of a good kind of a chest thump to get the babies going. Look, it was 1940s, 1950s. Pretty bright, as opposed to having babies who passed away from whooping cough. So it's caused by a bacterium, Bordetella pertussis, okay? And what happens is when you get it from sneezing, being breathed upon, and the issue is even people who don't have symptoms can pass it on to little babies or immunocompromised people who tend to be most vulnerable. For example, a lot of babies who are less than 1 will get it maybe from a sibling who looks like they just have a cold, or from an adult. And when you get that Bordetella pertussis, when you breathe it in, it has a toxin which is an issue for the cilia in your respiratory system. So when I say cilia, I'm talking about the little hair-like projections that are all down your trachea, your windpipe. And these help the cilia normally push bacteria and other foreign invaders. They push them away and kind of keep them out of your respiratory system. Well, when the whooping cough bacteria, when pertussis actually releases its toxins, it paralyzes those cilia. And long story short, it causes inflammation, eventually causes you to have a cough, which could be deadly. The good news is that we do have antibiotics. And if you're treated early, or even with a pre-prophylaxis, like if you have exposure and you're not officially diagnosed, if you start taking the antibiotics, then many people can do well. But as we know, we've already had deaths. And again, my traumatic situation was when I was in residency at Georgetown, and literally, even with all of the support with the breathing machines, we had a child who actually passed away who, got septic and had the whooping cough. So it's just something that's so preventable. And that's what really bugs me, that it's preventable. So as far as the vaccines, the schedule is for children ages 2, 4, and 6 months. You're offered the vaccine. You get it again at 15 months, and again between 4 and 6 years of age, and then again in that preteen teen age, 11 to 13. Oh, this is important. Pregnant women. It's recommended in the 3rd trimester that pregnant women get an updated pertussis shot, like a tetanus pertussis, Tdap, because it will help to prevent your baby from getting sick from pertussis. And studies show us that when the mothers in the 3rd trimester get the pertussis vaccine, it protects your child 9 out of 10 from getting in the hospital. Okay, you get a 90% protection of your child being in the hospital with whooping cough. All right, any other comments, Shador?
Yes, I am paralegal.
Oh, hi, I am paralegal.
I am paralegal says bacteria become more resistant, and many folks are scared to get vaccinated.
So even if bacteria become more resistant, okay, so let's talk about the logic in that. So when bacteria become more resistant, if you're actually already vaccinated, then at least that will give you more protection than if you weren't vaccinated at all. For example, we know that as that C19, the 2020 virus, as it mutated, a lot of times those of us who got vaccinated had vaccines from a previous mutation, but that still gave us more protection from the new mutations than if we didn't have a vaccine at all. And, when we're talking about resistant bacteria, oftentimes it's when people are taking antibiotics and not taking them properly. For example, if you're supposed to take antibiotics for 7 days, but you only take them for 2 days, well, then the bacteria who are still alive are the ones that are more resistant, and those are the ones that will spread. So bottom line, the vaccine and breeding resistant bacteria are pretty separate things. But these are good points to bring up, because that lets us know, as healthcare providers, as for people in public health, we need to do a better job with education, because these fears are real and something's happening for these numbers to drop.
Yeah,
probably largely. What's that?
Ms. Phyllis, she chimed in as well. She says false information and self-induced ignorance due to conspiracy theories, why people are not getting vaccinated.
I know she didn't say self-induced ignorance. That's a good one. That's a good one. And I actually agree with you, Ms. Phyllis. I think that's the biggest thing, the conspiracy theories. And it hurts when the conspiracy theories are coming from the top, right? From people who are actually in office and who are in the head of HHS. That's what really is it. And I think that I know, because we're looking at the numbers, after 2020, that's when we saw a lot of the vaccine levels drop. That's when we saw a lot of things drop. But hopefully, being here on Medical Monday and, doing these lives, and with all of you, with your information, if we just kind of keep pushing out truth, pushing out evidence-based medicine, hopefully we can get past that. Meanwhile, please consult with your doctors, consult with your pediatricians, consult with your OBGYNs, pregnant women and women planning to get pregnant, on what you can do to get the DTP, okay, diphtheria, tetanus pertussis for your kids, or as adults, Tdap, the tetanus pertussis vaccine, to protect yourself from the whooping cough. All right. I love that little game, myth versus fact. And thank y'all for participating. Please go ahead and give us a like and share this information. It lets people know that we're here on YouTube, on Instagram, on Facebook. Please share that we're giving evidence-based information. And for those of you in the replay, hey, make sure that you give us a like and that you share it as well. All right, let's get into our weekly dose, shall we? All right, this is our weekly dose where I give you a fresh take on medicine in the headlines that you just can't get anywhere else. Let's start out. talking about the mother of the queen bee, Beyonce's mother, Solange's mother, Tina Knowles. She shared that she had a diagnosis of breast cancer just this past summer. And she said, she's normally a pretty private person when it comes to her own life, but she felt compelled to share because she knew she could help others. And I'm so excited that she agreed to share. And she has a new book that's out, Matriarch. I believe she touches on it in the book. But let's play that clip and let's talk about breast cancer.
I could have caught this at stage 0 if I had not missed my mammogram, but I did because of COVID.
Tina Knowles opened up about being diagnosed with stage 1 breast cancer in a recent interview with People magazine.
Well, I struggled with whether I would share that journey because I'm very private, but I decided to share it because I think it's a lot of lessons in it for other women. I wanted to make sure that they knew how important it is not to slack on your mammograms.
She told People magazine her diagnosis last year came as she and Beyonce launched a hair care line and when Knowles was finishing her memoir titled Matriarch.
Yeah, I'm gonna tell you the truth. I love myself some Tina Knowles because, yes, of course, she's there for her daughters, for Solange, for Beyonce, but I also like the way that she never stopped supporting Kelly, right? Kelly Rowland. And even if you go to her page, there'll be people, names that we don't know, but she'll go and she'll find excellence and she'll support. And when you see her in interviews, look, she talks about her own kids. She talks about herself. She's just down to earth and very transparent. And I appreciate that about her. And I know that she had lost a lot of weight recently. And she actually shares that part of that weight loss journey was for her whole entire health journey, because if you're living with obesity, not that she was living with obesity, but if you're living with obesity, that is a risk factor for breast cancer, okay, in and of itself. But either way, she got diagnosed and she shared that she missed some mammograms. So as we get into this breast cancer discussion, I want y'all to put in the chat, what do you think some reasons might be for a person to miss mammograms, okay? Is it just because they're uninformed? Are they ignorant? Are they lazy? Are there some legitimate reasons? Why do some women skip their mammograms? Give me some reasons, please. All right. And the other thing I want you to put in the chat is, why is it that Black women are at a higher risk of dying from breast cancer? We're 41% more likely to die from breast cancer than any other ethnic group. All right. So while y'all are putting that in the chat, let's talk about breast cancer. Okay. So we know that breast cancer is when there is a mutation or a change in your breast cells, and it causes those breast cells to divide and divide and divide, and in some cases to actually leave the breast and invade other tissues. Okay. Because normally when we're dealing with cells, every cell has a specific life cycle. The cell comes to life, it lives, and then it passes away, apoptosis. But when you're dealing with cancer, these cells do not act like they don't know how to act. They keep multiplying, dividing, and they invade. And that is what cancer is, breast cancer included. Well, breast cancer is the most commonly diagnosed cancer, outside of the skin cancer conversation. And it's the second leading cause of cancer death among women. But we definitely do know that men can get breast cancer as well. Oh, put in the chat, what men do you know who have had breast cancer? 1 out of every 100 cases of breast cancer is in a man. So if you're a male, if you got males in your life, I want you to listen to this as well. All right. So breast cancer. A lot of people think that, I don't have a family history of breast cancer, I'm not worried about it. And I know for a fact that's a reason that some people will skip mammograms. But hear this. 85% of the women diagnosed with breast cancer have no family history. So just because it doesn't run in your family, please don't miss your mammograms because it can still happen to you. All right. So there are different stages of breast cancer. And you heard Ms. Knowles say that had she not skipped her mammogram, then perhaps she could have caught her cancer in stage 0. So I'll just briefly talk about some of the stages. So when someone says stage 0, what in the heck does that mean? It just means that cancer cells are detected, but they haven't spread at all. They're still inside of the lobules or inside of the milk ducts, and there's no sign of them actually getting out of cells. Okay, but it's caught, and that's a really great prognosis if it's caught at that stage. Now, when you move on to stage 1, that's when the cancer is less than 2 centimeters and it's just showing signs of invading into the breast tissue, but it's still definitely within the breast. It's not out, it's not touching the muscle, it's certainly not metastatic or spread everywhere like with stage 4. So catching it at early stages, stage 0 for sure, stage 1, you're going to have a better prognosis. And what's the best way to catch breast cancer at an early stage? To get screened, right? To have your screening mammograms. All right, anyone so far, Shador, commenting?
Yes, they are, Dr. Frita.
All right, what do we have?
Victoria, she said they're not getting the mammograms because they are scared.
That's a real thing. That's a real thing. And so it has nothing to do in a lot of cases with ignorance or lack of knowledge, because I'll tell you the truth. And yes, I go and I get my mammograms and I do all my stuff and I do my screening. But even with all the knowledge I sit up here and I tell y'all that I have, I'm always a little scared also, like, what if? And there are times when I've had, all my appointments lined up for my children. I've made sure that, they've got their dental appointments, their healthcare appointments, their basketball training appointments. And I put all of their things before myself sometimes. And I have to pause and just tell myself off, because I know that there's a little bit of a fear that will sometimes make me want to push my own stuff back. And so I'm sharing that with you to let you know it has nothing to do with intelligence. Fear is a real thing. But the truth of the matter is, whether you get your mammogram and get a diagnosis, or if you skip the mammogram and you don't know, the diagnosis is the diagnosis, okay? And so you may as well just face up and find out early, get the early detection so you can get the treatment, just like Ms. Knowles said. But that's true. Fear is a big reason why a lot of people will push it off. That's good.
Kay.
Hi, Kay.
She said mammograms hurt.
Now, you're not lying about that, but honestly, listen, and I kind of joke a little bit, but I'm serious, but joking, but serious. They're not the most comfortable thing in the world. It's true. They put you in these mammograms, and the 3D mammogram look, that's going to give you the best look, especially if you're a person with dense breasts. A lot of younger women have dense breasts. A lot of Black women have dense breasts. In that 3D, as opposed to the traditional 2D mammogram, will give you a better look, a better chance of picking up cancer. So request a 3D mammogram. And if your insurance doesn't cover it, don't just say, okay, at least ask about the cost or ask for pre-authorization. Okay, but yeah, so they do put you in there and they mash your breast down like pancakes. They have you breathing, holding your breath, doing gymnastics. It's not comfortable. But if we're honest, it's just momentary discomfort, right? A matter of minutes and then it's over. So a matter of minutes of temporary discomfort, definitely worth it to prevent a late stage or spreading cancer diagnosis and to prevent being unalived from breast cancer. But you're right, that could be enough for people to be like, I can't stand getting in there and having them do gymnastics with my breast. It's true. But yeah, we won't let that be a reason. Although I agree that could make people put it off, that mammograms can be uncomfortable.
Yep. Tisha, hi Tisha. She says both lazy and scared, and we were not taught.
Look, Tisha keeping it real. So yeah, the we're not taught part is a real big one. So yeah, you could kind of not feel like it and be scared. But if you're not taught and you don't really understand that, especially as Black women, there's a 41% higher chance of dying than any other ethnic group. If you don't know that fact, if you don't know that statistic, then that lack of knowledge will keep you from being motivated. Because let me tell you something, I could be lazy about a lot of things, but if I find out that doing the preventive care can keep me alive on this earth for a little bit longer, bump lazy, I'll go do it. So probably what you said, Tisha, the biggest one is a lot of the education is not really out there as much.
Mm-hmm. Yeah.
What else? These are good.
Tisha. Hi, Tisha.
Hi, Tisha.
He says, for both questions, Black women are sometimes too busy taking care of others, so we do not take care of ourselves.
The superwoman complex, let's get into that. And that's what I was alluding to, making sure everyone's taking care of your children, your parents, your best friend, heck, your dogs, honey. You make sure your dogs go to the vet sometimes more frequently than you take care of yourselves. But we need to take off that cape, right? Take off that superwoman cape. Because the truth of the matter is, if you're a healthcare provider, if you're not around, if you don't take care of yourself, then there's a chance that you won't be around to take care of others. But that's a real thing. And I also want to talk a little bit really specifically about Black women on why it is that Black women are 41% more likely to die. Well, here's the deal. It's a combination of things: genetics, socioeconomics, education. But for Black women, we tend to get diagnosed at younger ages with more aggressive cancer, right? So a lot of women will get diagnosed even before the age of 40, when really, with a lot of the recommendations, standard recommendations, it's not even recommended that you get your first mammogram until age 40. Now, if you have a family history or a genetic marker that's positive, then certainly the recommendation is for you to get your mammogram earlier than 40. Consult with your physician. But in general, we tend to have more aggressive forms of cancer. And also, some of the risk factors for cancer are obesity, diabetes, heart disease. These 3 illnesses plague Black women disproportionately. And so we have some of the illnesses that put us at a higher risk. And then again, the socioeconomic status. If you don't have health care, if you don't have the education where you have good preventive health care, where your doctor is making sure you stay on top of things, if you're working your 9-to-5 job and your supervisor gives you an attitude, if you take off just for a couple hours to go to the doctor and you're scared that you're going to get fired, then you might not be in that socioeconomic position to leave work and go and take care of yourself the way that you should. So definitely the socioeconomic status plays a big role. And then here's the other thing. Black women tend to get diagnosed more frequently. Like we're 2 to 3 times more likely to have a very difficult to treat breast cancer, triple negative, one that doesn't respond well to a lot of the treatments, the hormonal treatments. We're 2 to 3 times more likely to have that form, that aggressive breast cancer. So there are different factors involved. Knowing that, we really, really, really have to be proactive, really try not to miss our mammograms. And again, I really appreciate Miss Knowles, Beyonce's mom, Solange's mom, Miss Tina Knowles. I appreciate her for sharing, because she has all the access in the world, right? She's got access, she's got education, she's got all of it. And even she got so caught up in her busy life that she missed some mammograms. And actually it happened, she said, initially during the lockdown, during COVID, where she had an appointment. They said, oh, we're holding off on appointments right now with the lockdown. We'll reschedule. And then just kind of time got away from her. So it can really happen to anyone. So yeah, make sure that right here on this YouTube channel, Dr. Frita, if you put in the YouTube search bar, Dr. Frita, breast cancer, I have a couple of videos where I go into details on breast cancer explained. I talk about staging. I talk about treatment. I talk about all the things. So make sure, and then even on my television appearances here on this Dr. Frita YouTube channel, if you go to my playlist, television appearances, I have done several national news shows talking about breast cancer, different recommendations. So you can have all the information you really need on breast cancer right here on the Dr. Frita channel. All right, as we move on to the next topic, make sure you give us a like, make sure you subscribe, make sure you follow, make sure you share. Please do all the things, because are y'all having fun? I'm having fun. Let's go into the next topic, shall we?
Yep, before we do, Dr. Frita, shout out to our newest member, Miss Andrea.
Thank you for joining, Miss Andrea. Oh, I hope you can stay today, because we're having the members only live Q&A right after this. Thank you for joining. And listen, as a member, you get all kinds of perks, depending on the level. If you join us at our entry level for membership, you'll get, membership emojis, loyalty badges, you'll get shout outs. And then you're also, depending on the level, you'll get a first look before I release YouTube videos. I have a YouTube video coming out this week, but I'll give you a first look right here for the members only. I'll be talking about stress, y'all, the science behind how stress causes high blood pressure. Stress. We'll talk about that. And then also I have just members only videos where I hop on and just share some different extra medical information, extra perks. So I appreciate you for being a member. And for those of you who are not members, please make sure that you subscribe. And that's a free way to support the channel. All right. Yay. Good deal. Good deal. All right, let's talk about dyes in our foods, Shador. Now, we talked earlier, some months ago, on how there was a ban of a red dye number 3, which we've known since the 1990s could cause cancer in lab mice and lab rats. It has been banned from other countries for decades, from many other countries. And here we are in the United States. We are leaders of the free world, high income country, but we didn't have it banned here. So now that one's been banned, even though manufacturers have 2 years before they actually have to get it out of the food. So yes, that red dye is probably still in your food. But now the FDA is moving to ban 6 more dyes. And it looks like the science really supports that these dyes also can have some detrimental effects on the health. Let's talk about this clip, and then we'll get into some of these dyes. And in the chat, if you eat any of the foods that I'm going to share with you, the foods, the drinks that have these dyes, or if your kids or grandkids eat them, please put in the chat and say what your kids eat. Okay.
Changes could be coming to what we eat. The Department of Health and Human Services is moving to ban several artificial food dyes that have long been under scrutiny. Rashad Hudson has more.
Artificial food dyes are in everything from cereal to candy. But now, federal health officials say it's time for them to go.
Industry is making money on keeping us sick.
Health and Human Services Secretary Robert F. Kennedy Jr. says the U.S. will begin phasing out the remaining 8 artificial dyes still used in processed foods.
We can't continue to exist like this.
Kennedy says studies have linked these dyes to behavioral issues in children and other health concerns. The FDA says the science now supports removing them altogether.
For companies currently combining petroleum-based yellow chemical and red dyes together, try carrot juice.
Manufacturers will have 2 years to reformulate products, something that's already being done in countries where these dyes are banned.
West Virginia Governor Patrick Morrisey already signed a bill into law banning certain food dyes.
Going to get the crap out of the food. That's actually really important.
He told me his state is ready to support families and food companies during the transition.
The best way to make these changes is not state by state. It's looking at it nationally. What West Virginia has done is to be a leader.
Prior to Kennedy's announcement Tuesday, 26 other states started considering similar legislation around banning food dyes. Reporting in Washington.
All right. So y'all know every week I come in here and I have something to say about Health and Human Services on different things I disagree with. I'm actually with them on this one, on banning these dyes. And I believe these dyes should have been banned years ago when the science first started supporting that they could have serious health effects. We know that some of the dyes, these petroleum dyes, can be linked to hypersensitivity, allergic reactions, and to hyperactivity, like an ADHD. The science really supports it. And we see that even sometimes the same manufacturers who will make a food product for us in the United States and have these petroleum dyes in Europe or other places where the dyes are banned, guess what? Miraculously, they will use natural dyes, which are safer, perhaps more expensive. They'll be safer. And so why didn't we make this demand earlier? I don't know, but I definitely do support it. But let's talk about some of these dyes that are being banned. And I want y'all to put in the chat if you or your kids or your grandkids have any of these foods that have these dyes. So red dye number 40 is one of them, and it can dye things, red, like, fruit punch, Gatorade, Skittles, things of that nature. So take a look at this list and let me know in the chat any of these foods, drinks that you might have or your family members might partake in that have red dye number 40. And yes, it can be associated with hyperactivity and with allergic reactions. And then there's a yellow dye number 5 that can be in Mountain Dew. Do y'all know how much caffeine Mountain Dew has? Sweet goodness alive. Mountain Dew has a very high amount of caffeine. And, I know coffee, tea, those things have caffeine. And it's something to check out right here on this Dr. Frita YouTube channel. After you finish this live, check out my video on Is Caffeine Bad for You? But yeah, so yellow dye number 5. Take a look here and put in the chat if y'all think y'all have had some yellow dye number 5 exposure or family members. There's also yellow dye number 6. Again, it could be in drinks. It can be in candies. There is blue dye number 1, blue dye number 2, Skittles. Okay, let me just tell the truth. My son especially loves Skittles. And I do put my hand over there and have him put a few in my hand sometimes. I'm just telling y'all the truth. But these are things that you can imagine cumulatively over time, this exposure to dyes or letting our kids have them in high amounts. Now we're seeing, it can be detrimental. It can be detrimental. And there's a green dye also that's on the list. Mm-hmm. All right. So just make sure, you look at labels, keep up with what's going on in the FDA. Again, this is something I do support. We can still have the pretty colors. We can just use natural dyes instead of petroleum dyes. This is long overdue. I support it. Let's get the dyes out of the food. All right. Y'all make sure, please give us a like. Please give us a like. And in the replay, hey, replay crew, I want you to make sure that you comment, please. Let's keep the conversation going. Okay. So as we get ready to get into our next story, did anyone put in there any of the foods they're guilty of? I told you all about Skittles. Oh my goodness, my kids like Gatorade also. I need to take a look. So I know some of the Gatorades are clear. People just need to drink water, y'all. Let me just go and tell the truth. But you see how some of these Gatorades have red color, blue color, bright green color. Take a look. I'm quite sure they have some of these dyes. I know they do because it's been listed, it's been researched. But anyone share that they take part in some of these dyes, or that their kids or grandkids do?
Yeah, absolutely. So Miss VE.
Hey, Miss VE, welcome.
She said red dye. That means no more red velvet cake during the holidays.
Woo! It is the dye in red velvet cake. And specifically, I know red dye number 3. And again, that one's already been banned, but they're giving consumers 2 years from the time of it being banned to actually get out. So yeah, it's definitely in red velvet cake. Listen, that red dye is in things you wouldn't even necessarily suspect. Like if you think about salmon, not the wild caught organic natural salmon, but like the farm raised salmon sometimes that has that perfect pink color, red dye number 3. And even certain yellow rice. Yes, I said yellow, but it'll have red dye number 3 in it. Certain lipsticks, cosmetics, all kinds of things that you wouldn't necessarily suspect. Certainly red sodas. And with this other red dye number 40, like Fanta drinks, things of that nature. Yeah, you're right. It's there. Okay. Anyone else we get ready to move on, Shador?
Yep. A couple people trying to their husbands love Mountain Dew. That's from Miss Adele.
Yellow dye number 5. Please share this with your husband.
He drinks that every day.
It's a trip. It's so funny. It's almost like a little cult of people. I don't even know if Mountain Dew is the most popular drink, but for people who drink it, baby, that is their drink, their daily or every other day drink. They are Mountain Dew people. They're not trying to hear about these other sodas. Y'all, please let water in your life. After this video, after this live, check out my video here, Dr. Frita, the benefits of drinking water. Somebody help me. But Mountain Dew and all of this caffeine, honey, your husband's probably be awake from now until the end of time. Sweet Jesus. Okay. Yeah. All right.
And Miss Paralegal, she said, I am paralegal. Her husband, she's been trying to get him off of it for years. She's been on him about it.
Good luck. I am paralegal. I definitely want you to check out my caffeine video. Is caffeine bad for you? And then look at the caffeine content. And now throwing yellow dye number 5. Listen, you're I am paralegal, but I can help you to build a case on getting him off. Look, let's work together on this one. Let's work together on this one. Thank you for sharing. All right, Shador, shall we talk about weight loss?
Yes.
Shall we? Now, you know that I am, yes, most recently board certified in obesity medicine. We talk here all the time about, living with obesity, how it can put you at risk for many things, including breast cancer, heart disease, diabetes, joint pain, you name it. It can do all of those things. And now, here in 2025, we have better treatments than we've had ever before. Of course, lifestyle, diet, exercise. But the more research we're doing, we find that it's not just a matter of move your body. It's not just that. Some people have genetic predispositions to living with obesity. Some people have food addictions. And we have medicines like those GLP-1 agonists that can help. They're not without side effects. And if y'all have any questions about side effects of GLP-1s, like the Mounjaro, the Ozempic, the Zepbound, the Wegovy, put those in the chat. And if I have a chance, I'll touch on some of those. But they are very effective drugs. We know that Zepbound is actually FDA approved for helping with sleep apnea. Okay. And we've also had other studies like the FLOW trial showing that some of these GLP-1 agonists have been associated with improving or at least a slowing down of the progression of kidney disease. That's very complex. But let me talk to you about Lizzo. Y'all know I'm a Lizzo fan. I don't even pretend. Went to a Lizzo concert. Oh, so much fun. Lizzo has been out, all about body positivity. And she recently lost weight. And some people have been like, I thought you were happy being big. Lizzo lost weight. She said she had, some health concerns, things of that nature. She's now reached her goal and she's sharing some of her diet swaps. So let's first play this clip from Lizzo and give a little chat about her.
Is it alive? If you weren't on the live, this does not apply to you. But if you were on the live, y'all were asking me what I eat in a day and what I was going to eat today. And I described it to you, but I just wanted to show you because I got really fucking hungry after the live. These are the jerk bison balls, and this is rice and peas with cabbage, and I'm gonna pour some hot sauce on this and go to town, cause you know we got to get down.
Okay, Lizzo. All right, now what I do like about Lizzo is that she's sharing really some of the diet swaps. For her breakfast, for example, she shared how she's gone from having really sugary, high carb breakfasts to more savory breakfasts. And as you see on that plate, she had a lot of food, but it was really high protein. She had vegetables. Now, hot sauce, honey, I'm like Beyonce. I got hot sauce in my bag swag, but do understand hot sauce is loaded with sodium. So just make a little note. You still want to be a label watcher. And no, your diet's not going to be perfect, but just making sure you're aware of everything that you're doing. Another really neat thing that Lizzo shared, oh my gosh. She said that prior to her doing these diet swaps and really working on getting to a healthier weight, she would take in 1,200 calories in beverages alone each day. And if you think about it, some of these drinks, these Starbucks drinks, Dunkin' Donuts, you know, these different specialty coffee drinks, you can easily do that with a couple cups, 600 calories each. I want y'all to put in the chat, how many of you think that, you know, on some days you do 1,200 calories in drinks alone? Honey, don't drink your calories. My goodness. All right. So while y'all are answering that question, and also I want you to put in what are some diet swaps that you can name that might help. For example, using yogurt instead of using sour cream, or using, you know, fat-free creamers or no creamer at all instead of using that thick half and half. The different things that you do that are diet swaps that help you. Using, I don't know, quinoa instead of white rice. Put in some diet swaps that help you and as you make your choices for getting toward a healthier weight or maintaining a healthy weight. All right, the next person is the actor Jason Biggs, who's actually lost 35 pounds. And for him, he talks about some real health numbers that have changed since his weight loss. Let's play that clip, please, Shador.
Yeah, Mike, I had some cholesterol issues, probably because of previously mentioned ice cream pints that I would knock back. And so
how did you lose the weight?
I lost it through a combination of diet and working out. Yeah, like it's been a journey.
And how much have you lost, do you know?
40 pounds.
Wow.
Yeah, 35.
Holy that's a lot of weight. Do you feel different? Like, do you carry yourself differently?
My cholesterol came down 70 points.
Wow.
So, yeah.
And how long did that take you to lose that weight?
A while. A while. It's been a journey, but yeah, happy to be here.
Honey, she was asking detailed questions and he was popping her off with some general answers. But the thing he was specific about was that his cholesterol went down 70 points. And we know that having high cholesterol can clog your arteries, increase your risk for heart disease, vascular disease, amputations, strokes. So just him losing that weight is going to decrease his chances of having the number one cause of death, which is heart disease. And for other ways, listen, make sure you check out my video right here after you finish this live, how to unclog your arteries naturally, where I deal with natural ways to decrease your cholesterol. All right. Did anyone put any diet swaps or anything in here? Or is anyone else guilty of sometimes drinking probably a 1,200 of your calories from drinks alone, like from these specialty coffee drinks? Anyone?
Well, no one answered that question, Dr. Frita, but Miss Sheila.
Hi, Miss Sheila.
She said she's a cauliflower rice instead of regular rice.
That's good. I love cauliflower rice. And, you know, in the texture, they get it pretty dead on, I think. Now, for those of you who are like, it's not the same. It's not the same. No, a lot of these swaps are not exactly the same. But if they are pretty good and if they get you, closer to your health goals, it's certainly worth a try. Yes, I love cauliflower rice. Anyone else?
Yes, ma'am. Miss B.E.
Hi, Miss B.E.
I'll get my cursor together here, people. Miss B.E. She also does cauliflower rice and almond milk, almond creamer, and sweet potato.
Very good. And so in doing the almond milk, then you're avoiding that dairy. And we know that dairy can sometimes increase mucus production and certain inflammation. So that's good as well, the almond milk.
I am paralegal, has CKD, so her diet is very strict. So I love sour cream, but it elevates my blood pressure, so I stopped eating it. My diet swap is dates and date sugar instead of cane sugar and sugar substitutes.
Very good. Very good. All right. Thank you for sharing. I am paralegal. Yeah, it's a mindset, isn't it? And sometimes it does mean giving up on some of your favorite things. Like I'm sure Lizzo would love to still be having pancakes, French toast, all the sugary breakfasts every day, but switching to something savory in her case, it makes a difference and it's worth it for your life. That's good. Thank you. I'm paralegal.
Mm-hmm. And then Tisha.
Hi, Tisha.
I use cream cheese and nutritional yeast in place of cheese. Instead of soda, I drink Spindrift on occasion.
Okay, very good. Yeah, these sodas can be loaded Interestingly, sodas can actually have sodium. They can have some of those dyes that we talked about that they're starting to get rid of. Certainly sugar, 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 sugar. So when you're able to find substitutes, that's really, really awesome.
I remember
right.
Miss Lane
Hi, Miss Lane.
says you can juice green apples, ginger, and kale.
Baby, now you're talking my language. And listen, for those of you who like to juice or want to start juicing, please check it out here on my YouTube, also on Instagram. Look, I have it pinned on my Instagram, like one of my favorite juices, which is the beet juice. But you can definitely juice, get lots of flavor, get lots of sweetness, and it's much, much healthier than drinking sodas. And if you're interested in my juicer, my favorite juicer, the Nama J2 juicer, just visit drfrita.com. That's my one-stop shop for kind of all of my favorite things. And I have a discount code for you there. But juicing, yeah, check out my juicing videos here. And yeah, very good. That green juice is a good one.
All right. Before we move forward, Dr. Frita, shout out new member, Miss Tisha.
Yay, thank you for joining. Okay, y'all, listen, y'all got to go because I got to get to my members only live. Miss Tisha, I hope you can join us for our members only. Get your questions together. Look, get ready to press the link. Come on up and talk to us. Let's go back and forth. Thank you for joining. I appreciate you. All right. So let's move into our last segment. As we do, please make sure you give us a like, share this video. I definitely appreciate you for joining us today. I really, really do. And, we're talking about all these health topics. One thing that we know is huge, and I mentioned I have a video coming out, the science behind how stress causes high blood pressure. But I already have my book out, Under Pressure, A Guide to Controlling High Blood Pressure, where I don't just talk about using medicines to treat high blood pressure. I talk about using natural holistic remedies, using food as medicine, exercise as medicine, slow, deep breathing as medicine, all of those things. So you can click the link in the description here. If you're on Instagram, you can go to my bio, click the link there. And you can always go to drfrita.com, the one-stop shop, and how you can get kind of all things Dr. Frita. All right. And as we, move into our 5-minute health check, yes, we have our members only live Q&A today. You get the link if you're a member at that tier. But also, if you want to talk to me one-on-one, then I do offer a telehealth concierge service. And that way I can talk to you from anywhere in the world. We have a lot of success and I'm really excited. I'm meeting people, I'm telling you, from all over the world, literally getting a chance to do a full history and talk to them about their problems. And, oftentimes I agree with the care that they're getting. Sometimes I give them kind of some other questions to ask. This is informational. And, I like to provide insight based on all the knowledge that I have. So yes, if you want to have a conversation with me one-on-one, a medical consultation, take advantage of this telehealth concierge service. All right, Shador, let's get into this 5-minute health check as we wrap things on up.
All right. New Mpox strain pops up in North Carolina wastewater. Health alert issued.
I will fall off this stool and cry right now. Do y'all remember Mpox? It used to be called monkeypox. Y'all knew that name was wrong from the start. How we had the Mpox outbreak and people were getting all these huge blisters on their bodies. It was being passed in different communities. The community that was believed to be at the highest risk, men having sex with men, because you tend to get it from very close contact, skin to skin. And then, and we do have vaccines, by the way, for Mpox, for those who are considered to be at high risk. Well, it's been kind of out of the headlines lately until now. Yeah, in North Carolina, they found it in the wastewater samples in Greenville, North Carolina. And so it's just something to pay attention to. Look at CDC updates. If you live in North Carolina, please be paying attention to the North Carolina Health and Human Services Department to find out if you're someone who should get vaccinated. Are you considered to be at high risk? Is it growing? But yes, Mpox has not gone away. So if you're someone who's at high risk, consult with your doctor and consider getting a vaccination for Mpox, formerly known as monkeypox.
All right. Hair loss solution or health risk, FDA warning.
Now, y'all know we all like to have a little piece of hair on our heads. And a lot of men specifically who will have male pattern hair loss will put like a topical finasteride. Okay, that's something they'll put on their hair topically, where, put it on like the skin where they're balding. And, the theory is that it will help with hair growth. It'll help you to grow your hair. Here's the problem. We are now finding some side effects, specifically with the topical finasteride. And those side effects, men, listen to me, the side effects have been depression, and erectile dysfunction. Okay. Now, y'all are putting the topical finasteride on your hair so you can have more hair. And I'm sure you're not trying to have erectile dysfunction or impotence or inability to perform in your love life. So these topical products are actually not FDA approved. The only ones that are FDA approved are finasteride that is taken orally, okay? Like Proscar, Propecia. So make sure you consult with your doctor. Don't just go on, online or go down around the corner to the pharmaceutical company or to the pharmacy. Don't do it yourself, okay? Go to your doctor or your dermatologist, which of course a dermatologist is a doctor, but go to your primary care doctor or your dermatologist to ask about, if you want to use finasteride, ask about the FDA approved one, and understand that if you're having a little problem with your love life and you're trying to keep from going bald, it could be because of your topical finasteride.
All right. Dance your stress away.
I love this one. Listen, Shador, listen, y'all. There has been a study that was done recently showing that in this study, they showed that dancing can actually be more effective in decreasing stress than in some of the more traditional exercises. And the belief is that when you dance, you release certain hormones, you release oxytocin, you release endorphins, plus the socialization that's involved in dancing can really help to decrease stress. And we know that stress can cause multiple medical problems. Yes, it can cause high blood pressure. It can increase your risk for heart attacks, increase your risk for strokes. Stress can even affect your immune system. And so now you can get up. Look, you have a reason to go down to the club. Tear the club up. It can reduce your stress. But yeah, check that out. Go ahead and dance. And listen, make sure you check out my video on top 10 exercises to lower your blood pressure the natural way. And, in those exercises, they also help oftentimes decrease your stress. But yeah, I like this one. That's a good one. All right. We're going to go ahead and wrap this up. Members, stay with me because I'm hopping off of this link and I'm going to our members only live Q&A right now. And for those of you who are in the replay crew who are members, don't worry, you have access to this members only live if you weren't able to make it. Any closing words as we hop off of here, Shador?
No, Dr. Frita.
All right. Thank you all for joining. I appreciate you. Please make sure you give us a like on your way out the door. Make sure that you share this information. We're giving evidence-based information here. We're here every Monday at noon Eastern Standard Time. And listen, this Saturday, y'all make sure you follow me because I always give you the update like on Instagram and Facebook. I'm going to be on Good Day Atlanta. And I'll be talking about health headlines with Dr. Frita. That will be this Sunday. But stay tuned. I'll give you the updates. Also on this past weekend, I posted from when I was on the Portia show talking about blood types, why it's important to know your blood types. I put part 1 up this past weekend. So make sure you check that out as well. And stay tuned because I'm releasing another one of these YouTube videos on this week. All right. Thank you. Thank you, Shador, as always, for being my wonderful co-host. Thank you to everyone in the chat, YouTube, Facebook, Instagram. And yes, I thank you, my replay crew. I'll see you next Monday. Thank you for joining me and making Monday your healthiest day of the week.